I'm Holly Mitchell, and I'm the founder of the LeadWell Network. And today we're going to talk about the 7 steps to effective change management. This is a topic I still struggle with because I want to do 100 things and I want to do them yesterday. Can anybody else relate? Especially when you're trying to grow your practice. You get really excited and you want to implement things. But sometimes you find out implementation is a little bit harder than it seems, especially when you have a growing team. When our practice was small, it was really easy to make changes because I got things done with the sheer force of my will. I was going to be annoying enough and persistent enough until it actually happened. But now that our office is more than 50 people, change management is incredibly important to have effective implementation. And if you skip these steps, often it takes way more time on the back end to try to clean things up and implement effectively than it would have taken on the front end if you follow the right steps. Now, I remember what it was like trying to bulldoze agendas and ideas, thinking that that was good, strong leadership, is making decisions and implementing and being a freight train or a bull in a china shop trying to get things done. But then I realized there are a lot of consequences to that approach. You don't always have buy-in from your team, and it can really damage the relationships and the trust with people. So the cultural consequences really aren't worth it. So learn from my mistakes, and let me share with you the 7 steps, the process to effective change management. Step 1 is awareness. So if you've decided that you're going to make a change, let's say you bought a new piece of technology, maybe CEREC. You're going to implement this in the office, and it's going to be pretty complex and challenging to implement, so you need the support of your team. It starts by creating awareness. Let them know that the change is coming. If we don't, and we just show up one day and we're like, we're doing CEREC now, this is going to create a lot of confusion and stress for the team. So let them know in advance, what's the date? When is this going to drop so that they can be mentally prepared? The next step is buy-in. So you need to sell the change. Tell people why a change is needed and how it's going to benefit the practice. But what's really important is people are going to want to know, how is this going to impact me personally? What are the upsides? What are the downsides? You need to be really transparent about the impact it's going to have on your team so that this goes as smoothly as possible. If you don't have that buy-in, you may have people that try to sabotage or campaign against the decision. Imagine there's somebody in your office who has trouble with technology. Let's say they've been working with you for 15 years, but technology changes are really difficult for them, and it makes sense. They're good at their job, and they like being good at their job. So if we're implementing a change that makes being good at your job become being awkward at your job, it's going to create a lot of confusion, anxiety, and they may indeed try to sabotage or put their foot down. This is when it's important to pull that person aside and say, Susie, you've been working with me for 15 years. I really value and respect you. We do have to make this change because it's what's best for our patients and our practice. But I want to make sure that you're comfortable, and we try to make this process as easy as possible for you. What do we need to do to make that possible? Because I need to make sure that I have your support. Everyone looks up to you. So if you're on board, they're going to be on board, and it's going to make my job a lot easier. So how can we work together? If you approach the person from a place of respect, but let them know that this change is coming and they need to find a way to make it work, you can get their cooperation. Step 3 in change management is skills. It's important, if there's a change that requires training, that you create a plan for that to happen. Everybody on your team needs to have confidence in the change. If they don't have the skills to meet that expectation, it's going to create a ton of anxiety, and it's going to take way longer to implement effectively. They'll often act out with that anxiety by becoming defensive. You might see people get upset or shut down and stop cooperating. So make sure that the training plan allows that time to build the confidence and competence that your team needs to effectively execute. Step 4 in effective change management is desire. Dale Carnegie said, "Arouse in the other person an eager want." How do you motivate your team to get on board with this decision? Now, different people are motivated by different things, and knowing this can really come in handy when you're selling this decision. Are they motivated by bonuses, by improving our standard of care and providing a higher level of patient experience? Do they want to be respected or noticed for a job well done? If you let the person know that by assisting with this change, they'll get what they want, you'll have an eager and willing co-pilot in executing this change. If you miss this step, you'll come up with a ton of resistance. Step 5 in change management is resources. Does the team have what they need in order to do the job right? Do they have the time? Do they have the skills? Do they have the people? Do they have the finances? Sometimes to implement a new change, we might need a new budget or some new systems. So get everybody who's going to be affected by this change in a room and get them to plan out exactly what they're going to need in order to be affected. A lack of resources means unsuccessful implementation and frustration for everyone involved. Now, the last step is really important. This is an action plan. And choosing the right people to put together the right action plan is really, really important. Sometimes we may make the mistake of having only the leaders decide on the action plan, but the people who are actually impacted by the change aren't a part of that conversation. So invite them to the table, because if we don't have them there, we're going to miss things, and we're going to end up on a treadmill, putting in a lot of effort and not really going anywhere. An effective action plan is designed by all affected parties with a to-do list of who's going to do what by when, and a series of follow-up meetings. So just discussing the action plan once isn't enough, because then we have to play it out in real time and tweak it along the way. Have frequent follow-up meetings so you can check in on the success. If the implementation is going to be complex and require a lot of new habits being developed, it may take time. So at those check-in meetings, you might find that after week 1, we've implemented it 10% of the time. After week 2, it's 25%. But remain persistent and continue to have that conversation so that you can iron out the kinks along the way and hold the team accountable to success.